Good morning, welcome to Breakfast with Naga Munchetty and Charlie State.
Our headlines today. People needing medical care from the NHS are urged not to be put off by the coronavirus pandemic as visits to A&E dropped by almost half.
More virus tests will be offered today after online bookings were suspended in the face of overwhelming demand.
Good morning. Plans are being drawn up for the return of the Premier League. Yeah, the government has told us it's working hard to get live sport back on TV behind closed doors, but only where lockdown restrictions can be eased.
The oldest person to reach #1, Captain Tom Moore's charity single with Michael Ball tops the charts.
Good morning. It looks like another dry day for most parts of the UK. It may be a little bit grey and gloomy first thing, but it looks like for most of us there will be once again some strong April sunshine on offer.
Good morning, it's Saturday, April the 25th. Our top story today, a huge drop in the number of patients seeking urgent treatment for conditions unrelated to coronavirus is fueling concerns that serious problems are being missed.
The NHS is launching a campaign to encourage anyone with health concerns to seek help as the number of A&E patients fell by half in the last month. We're going to talk to the medical director of NHS England, Professor Stephen Powers. First, though, here's John Donnison with the latest.
Much of the fight against COVID-19 has been about trying to keep people safe and out of hospital. But today the NHS is encouraging people not to be afraid of seeking treatment for non-coronavirus conditions.
It could cost lives. Now, we've known for a long time, and there have been many campaigns in the past about the number of people going into A&E or contacting their GP when they didn't need to be seen. And I have to say, I'm very surprised. I never perhaps expected in my professional lifetime to be saying the opposite.
It comes as figures from Public Health England show the number of people going to A&E over the past month is down around 50% compared with the same period last year. That's 1 million fewer visits.
We are here for non-coronavirus patients too. So if you're worried about chest pain, maybe you might be having a heart attack or a stroke, or you feel a lump, or you're worried about cancer, or you're a parent concerned about your child, please come forward and use the health service in the way that you normally would. It is going to be better to sort those problems out now rather than leave them for later.
Meanwhile, the new government website on which key workers and their families can book coronavirus tests reopens this morning after it was inundated with requests yesterday. Almost 50,000 people in England tried to book a test just hours after the website was launched. 16,000 people did manage to get a drive-through appointment or a home testing kit. In terms of the number of people dying, figures released yesterday showed 768 more reported coronavirus deaths in the UK since the day before. It takes the total number to more than 19,500. It could well reach 20,000 today. And because that does not include deaths in care homes or the community, the real figure is likely to be much higher. John Donnison, BBC News.
Well, let's speak now to our political correspondent, Nick Earley, who's in our London newsroom for us this morning. So, Nick, it's interesting. Looking at many of the front pages this morning, a lot of suggestions about how things might be changing in terms of social distancing. Football, for example, there are stories about that, about how business might operate. What's the official line on the nature of these stories?
I mean, the government isn't really going into detail at the moment, Charlie, about what lifting lockdown will look like, for the simple reason that they want to keep the message pretty simple at the moment, which is, you've heard it many times, stay home, save lives, protect the NHS. There have been some movements in Scotland and Wales, but at UK level, not that much discussion about exactly what it will look like. However, particularly on that story about the Premier League potentially being back up and running in a few weeks behind closed doors, it is something that officials in the government are talking about. It's something that is being taken seriously. Government source saying overnight that it was something that, you know, it wouldn't be the same as stadiums being open, but it was something that they were hoping to get going to try and bring something resembling normality back to our lives.
And Nick, we've learned some new phrases, haven't we? Some new organisations that are very important in the government's thinking. The Scientific Advisory Group for Emergencies, SAGE, meet all the time and they advise politicians about the science, about the medicine. And there are questions about who's involved in that.
Yeah, that's right. I mean, we've heard the government say over and over and over again that all the decisions that's being made, that are being made with science in mind. Really interesting that it turns out that Dominic Cummings, who's the PM's chief advisor, has been taking part in some of these SAGE meetings. Now, Number 10 say he's there to listen and to help when he can, to talk about what goes on in government and how it works. Some are raising concerns, though, that it might mean that politics is playing a part in how those decisions are being made, or that Dom Cummings might actually be taking those messages back to the PM himself rather than the chief scientific advisor. Number 10 totally denying that, saying that this doesn't change anything, that those scientists are still the most important people making the advice available to government, but some concerns still being raised there.
Nick, for the moment, thank you.
Let's take a look at the government's website for key workers in England, where they can request a coronavirus test. Now, if you have tried to book a slot or request a home test, tell us about it. Tell us how you've been getting on, because we were talking about it earlier this morning. Of course, a little later in the programme, 8:30, we're going to talk to the Medical Director of NHS England, Professor Stephen Powis.
The US President Donald Trump is facing a continued backlash over his suggestion that coronavirus patients could be treated with injections of disinfectant.
He ended his latest White House news conference without taking any questions from journalists. This is after he was widely condemned for his previous remarks. Yesterday, Mr. Trump insisted he was being sarcastic when he made the suggestion. Our North America correspondent David Willis has more.
Thank you very much.
And with that, they were gone. A daily press briefing which routinely stretches beyond 2 hours, all over in 22 minutes. Donald Trump's reluctance to face further questions seen as a response to the backlash he's faced over comments made to the coordinator of his coronavirus task force the day before.
Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number of the lungs, so it'd be interesting to check.
That prompted a torrent of ridicule and condemnation, government officials warning of the health problems that ingesting household disinfectant could cause. And a stark reminder from Mr. Trump's Democratic rival Joe Biden, don't drink bleach. President Trump has since said he wasn't being serious, even though he appeared so at the time.
But I was asking a very sarcastic question to the reporters in the room about disinfectant on the inside. But it does kill it, and it would kill it on the hands.
Meanwhile, more than 50,000 people here have now died from the coronavirus. But in Georgia and some other southern states, hairdressers, tattoo parlours and nail salons have already started to reopen, despite warnings from health officials that it's too early for them to do so safely. David Willis, BBC News, Los Angeles.
See the headlines as they happen and watch BBC News live in the app and get the full story with bbc.co.uk/news. Follow the story for all the latest.